Cases are trending downward, but health officials say don't let your guard down just yet. The illness can be more serious than many people realize, and the threat is still very real. News 2's Tristan Winder joins us in the studio with details on what healthcare professionals are recommending. Tristan?
We're in the middle of what is traditionally the heart of flu season. And while cases are trending downward locally, physicians are stressing that does not mean the virus or similar illnesses have disappeared. In fact, healthcare professionals are reminding families that simple steps can make a big difference in keeping yourself and your loved ones healthy. Dr. Melissa Moselle with Great Plains Health says traditionally winter respiratory illnesses peak during December, with the trail off beginning in early spring.
So we have been seeing quite a few influenza cases. The good news is that it's downtrending. We had our peak about 2 or 3 weeks ago in December, and even though it's downtrending, there are still cases circulating, and so it's good to be vigilant.
While the peak season may be behind us, cases are still spreading, which is why healthcare professionals say prevention is critical and the first line of defense.
So there are simple steps that we can do to help prevent the spread of illness and to keep our families healthy. Hand washing is always a good thing, so just reminding kids and families to wash their hands frequently. Getting vaccinated against influenza adds another layer of protection, and then staying home when sick helps keep the community safe.
Schools are a major breeding ground for the virus. Children spend their days in close proximity, which is why good hygiene practices matter so much.
That's why it's ever so important to make sure we practice good hygiene in schools and at home, and then cleaning those high-touch surfaces and reminding kids not to touch their mouth and nose all the time throughout the day.
Navigating when to see a healthcare professional is important. Minor symptoms like fever or cough can warrant staying at home, but certain warning signs require more timely attention.
So there are some symptoms that might make you a little more concerned, and so reasons to stay home would be if your kid has a fever, a cough, not feeling well. Reasons to call your doctor would be if you progress to having difficulties breathing or wheezing, high fevers that aren't going away after a couple of days, signs of dehydration, or any serious pain.
It's simple habits that make the biggest difference. Right now, hand washing, staying home when you're sick, and monitoring your symptoms. The flu may be on the decline, but the illness and others like it are still out there. Taking these simple steps now could save you from being sidelined later.
All right, thanks very much, Tristan.